The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today I'm delighted to be talking with Patty Barnes. Welcome, Patty.
Thank you, Don.
Now, you are a certified professional midwife, is that right?
That's correct.
And how long have you been doing that?
About 15 years.
15 years. So you've seen a few babies born. How many about?
About over 750 now.
And do you have children of your own?
I have 2 children.
And how old are they?
Genesis is, let's see, she's 24.
Okay.
And there's Jason. He's 18.
All right. Well, great. So you have a wealth of experience as a mother and as a midwife and with the time as well. You work with a team, I understand. You have some physicians and people that work with you as well where you're practicing. Today we're going to be talking about postpartum care. What does that big word mean?
Postpartum care is right after the birth through 6 weeks. And we do postpartum care on the mother right after delivery. Mm-hmm. We go back the 3rd day to check her and the baby again. Mm-hmm. Then we see her in 2 weeks. And then we would like to see her again at 6 weeks.
So 2 weeks, right afterwards, then 2 weeks.
3 days.
3 days.
2 weeks.
2 weeks.
And then 6 weeks.
Okay, got it. You know, one thing before we get into that, you and I were talking, and maybe we can just discuss this a little bit. What if someone has had several pregnancies and maybe the last one, or maybe their first one, or whatever it was a cesarean section or a C-section, you know, and they want to have a vaginal delivery or a regular birth? Can that ever happen?
Yes, they are actually encouraging VBACs. They call it vaginal birth after cesareans. Now, once a cesarean, always a cesarean rule is outdated now that the majority of the uterine incisions are low and horizontal. So the risk of the rupture of an old scar is less than 1%. This was proven in a FLAM study, 1994.
Okay, so it is possible then to have it again.
The American College of Obstetricians and Gynecologists recommends the practice of routine repeat cesareans be abandoned.
Mm-hmm. Okay, so it doesn't mean you just naturally have to have another one. Okay.
Right, and actually the VBAC rate is rising, especially among the younger obstetricians.
So if your physician is a younger OB/GYN, they're going to be more open to that. Or have you ever, as a midwife, delivered someone that was a cesarean before?
Yes, but we encourage the VBACs to be delivered in the hospital. Mm-hmm. And
just in case there is a rupture.
Yes, and like we said, it's very rare. But I know that they're estimating about 200,000 could be saved a year by giving them a trial of labor.
$200,000 across the nation, or okay. Let's go back to postpartum care. You know, we talked about when it is, 3 days, 2 weeks, and then 6 weeks again, right? Or immediately after the birth, too. But what do you do then? What do you do immediately after the birth? And walk us through that. What does it entail?
Okay, well, immediately after the birth, we check the uterus to make sure that it's firm. And the baby will be nursing right after the birth to contract the uterus. The uterus releases oxytocin. It's a natural oxytocin to cause the uterus to contract.
So that's a hormone or something?
Yes, and it causes the uterus to go back to size. It's called uterine involution, back to its pre-pregnant state. And so we check the uterus to make sure it's firm, and check for bleeding, make sure that there's very minimal bleeding. And we make sure that the mother is breastfeeding, the baby's latched on, and they're bonding her,
Let's go back to that, checking the what did you call it? The fundus?
the top of the uterus is a fundus.
Okay, and that's the top of the uterus. And how do you make sure it's firm?
We just stop to feel the top of the uterus to make sure that it's firm, and it should
So,
be.
like if I had a uterus, which I don't, I'm fairly certain, I'd be touching it right up here above my belly button.
Well, after the baby's born, it's usually about 2 fingers below the umbilicus.
Okay, so my belly button, and I just take 2 fingers, and
Go
below
below.
that, there should be what there?
The uterus, the top
Okay,
of the
what's
uterus.
it feel like?
It will feel just like a hard,
Fist?
I want to say grapefruit or something.
Okay, and if it's not there, what do I do?
If it's boggy, real loose and boggy, it will feel loose, but you probably have a bleed.
Okay, and then what do you
pretty
do?
goodly. Well, what we do is we would do what they call bimanual compression, where you clamp it yourself and you hold it until it gets firm. You can give, if you use herbs to control bleeding, and of course in the hospital they'll give Pitocin or a drug to clamp the uterus.
So that's like the oxytocin,
Oxytocin.
but it's a medication. Right. So you check and make sure, and if it's not, then you're probably have a bleed or something. Or,
Yes.
Okay, you got to be careful about that. Anything else then? Any education or different things that you tell moms?
Well, we make
afterwards?
sure that they're well educated, what to look for, if they have fever, pain, excess bleeding, check the baby, make sure that the baby's nursing well. And
How do you know if a baby's nursing well?
Well, they would, we wouldn't leave until the baby's latched on and nursing well. And we want to make sure that the mother who had the baby can get up and void, have a shower, and everything works normal before we leave. We wouldn't leave her until everything is fine, she's fed.
Okay, back to that breastfeeding thing. How do you know that it's attached well or whatever?
Latched on, the baby's latched on.
I mean, that sounds like, I mean, I pretty much can figure that out, but what do you mean exactly? How do you know if it's latched on well?
The baby will be nursing.
Okay. And no air or different things in there? Or?
Yes, well, you would know because it wouldn't be crying, it would be nursing.
Okay.
Okay.
All right.
Plus, let me just say this, it wouldn't hurt, you know, when the baby's nursing right, it wouldn't hurt her. Okay.
Oh, it doesn't hurt the mother?
Yeah.
Okay.
Because if it doesn't have a good latch on, then she could say, well, it just doesn't feel right.
I see. So, what should the mother then be watching for? I mean, you're there right after the delivery. Do you do the APGAR score then right after? Is
Right
that part
after
of
delivery.
postpartum care?
Yes.
What are they checking on an APGAR score?
Okay, we check at 1 minute and then at 5 again.
And what are you checking?
We check the baby's color. We make sure that the baby's breathing well. The heart rate is above 120. 120 or above. You know, normal rate is anywhere from 120 to 160. And we also make sure the respiration is good. The baby should be well flexed and not limp. And of course, we make sure the baby's warm. We put a warm towel on the baby and a cap on its head.
So babies can get cold pretty easy. Very
Yes.
important to do all that.
It's hard to hold their heat in for the first 24 hours. And that's why we encourage the baby to be extra
What about
warm.
when a baby gets yellow
Jaundice?
or jaundice, whatever you call that? Yeah.
Jaundice is fairly normal in newborn babies.
And why is that? What's going on?
Because we have an elevated bilirubin, the excess bilirubin, and the weakened or the immature liver of the baby, you know, is
Can't
having
handle
trouble,
that.
can't handle it. And around 3 days, the third day is a peak, and 8 to 10 days, then it should be fine. But usually the jaundice isn't a problem.
Do they put them, I mean, I know in the hospital and when I was in nurse training, they put me in this little nursery thing and there were like 30 babies in there and they had a bunch of them in these little lamps or different things. Do you do that at home?
We use sunlight.
Sunlight. Put them by the window?
Yes. And nursing is a benefit, helps flush the excess bilirubin, and also activated charcoal.
What about circumcisions?
Well, if they want to have circumcisions, we always recommend the 8th day, like the Bible says, because the vitamin K factor is the highest in the baby.
And they do that in the hospital?
Well, they have their own pediatrician. If they choose to have circumcision, they would go to.
Many times new moms like to call the doctor and check things out, or maybe they call you very often. When should they call their pediatrician?
Okay, well, they should call their pediatrician when they don't see stools or urination in 24 to 48 hours.
Well, that's constipation then? They could be bound up, that's why?
Well, after delivery, we just want to make sure everything works.
Okay,
So,
all right.
you know, it might be, but it might not be. It might be that something's not developed properly.
Okay,
Difficult breathing. Baby's color is blue.
okay.
Jaundice with lethargy. Remember we were talking about jaundice is
Yellowing skin and all
but
that.
is fairly normal. But if you have jaundice with lethargy and failure to nurse, then there's a problem.
So lethargy, that means just like what? Just being out of it?
Yes, it just lays around and you have to wake. Sleepy baby doesn't want to nurse
Okay.
him. Vomiting,
Okay.
fever over 99.6 under the arm, or umbilical cord red or swollen with odor.
Oh, okay, so there might be an infection.
It might be an infection.
Okay, so these are the reasons that you need to call the doctor then right away.
Yes, and we show them how to watch for signs and how to take care of the umbilical cord. Make sure that it's.
Well, how do they do that?
Well, we make sure it stays above their diaper. When they change, every time they change the diaper, clean it real well with
So
alcohol.
none of the fecal material gets on it,
Yes.
causing an infection
Right.
from that.
Keep it above their diaper so they don't urinate on it.
Okay.
Look for any pus or, you know, any swelling, or red irritation, or odor. So as long as you keep it clean, and it usually falls off about the 10th day.
So these stools that the baby has right off the bat, they could be a little bit something to deal with, can't they?
Yes.
So what advice do you give to them so they don't develop a rash or different things, or if they do, I've seen some pretty bad case of diaper rash.
Well, just to check them, you know, to make sure that they change their diaper often and not leave the urination or the messy stools on their bottom.
Mm-hmm.
But if they develop a diaper rash, they could, you know, they could use, there's some natural remedies like blended up oatmeal.
Blended up oatmeal.
Mm-hmm. Just like into powder, and that's real soothing and healing for the
Diaper rash. Open to
diaper.
air?
Yes, that's
Keep it
fine.
open to air.
Mm-hmm.
Any? What would you say? Cloth diapers better than regular ones,
Yes,
or
100% cotton.
100% cotton?
Mm-hmm.
So wash those diapers. That's better than the other.
Yeah, it's supposed to be less irritating, but I know the others would be more convenient.
Yeah, very convenient. Well, I know you've written a new book called The Ministry of Midwifery. Is that right?
Yes.
And it says it's a manual here as well. Does it cover the things we've been talking about today?
Yes.
And so you could have a reference for that. We've been talking to Patty Barnes. She's a certified professional midwife. And when we come back, we're going to be talking about other issues that you face with the newborn, breastfeeding, all these different types of things. So we hope that you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Luddington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Luddington have been featured on 3ABM, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Patty Barnes. She's a certified professional midwife. And we're talking now about what the mother has to face after the baby is born, so-called postpartum care. Is that what we call it? Does the mother need any help?
Yes, she does. We always recommend that hopefully the father can stay home and help her, or she can have her mother come to help her for at least 2 weeks. Also, I find that a lot of church members will bring in meals for the next 2 weeks postpartum.
So the biggest thing is to bring in activities that they normally would have to do on their own, cooking meals and different things, take care of those things for them.
Yes.
You know, I want to just point out that you asked me to ask that question, right? I mean, someone might be watching and say, boy, that's a pretty insensitive comment by that man to say, do they need any help, right? But you did ask me to ask that question, didn't you?
Yes,
Okay.
because you promised to take off work when your wife has a baby.
All right. When can she return to a normal lifestyle? And again, this is something we talked about, we needed to talk about.
Usually after the 6-week period, because 6 weeks postpartum is actually when the placental site is healed over. Because when the placenta comes out, after the placenta detaches, there is a space where the bleeding, where the placenta was, and the bleeding takes place.
So there's a potential for bleeding and different things if you
Yes.
get too vigorous in exercise and different things and all these different. How soon can you start exercising afterwards?
Right after the 6-week period.
Right after the 6-week period. But up until that point, you kind of take it easy. Can you walk?
Oh yes, you could walk. Your uterus starts returning to normal around the 10th day.
Okay.
Okay, 10 days to 2 weeks.
What about taking the baby out, taking the baby to church, to the store, to different places? When can they do that?
Well, when they feel like getting up and around, usually after the 3rd, 4th day,
Third or fourth day?
they're up moving around.
So the first
slowly.
week, maybe afterwards, they go back to church or different things?
Well, I recommend taking it easy for a couple weeks
Okay.
and just not overdoing it. And as far as exposing the baby to public, you just want to make sure that the baby's not exposed to a lot of sickness or whatever.
Don't have all the people in your church or in your whatever club you go to hold the baby? Just say, hey, just leave the baby alone for a while?
Well, you just don't want to overexpose the baby, so to speak.
Okay, so then 6 weeks that placental site is healed. I guess another big thing that may be a change, especially for new moms, but others, is probably breastfeeding.
Yes.
Is it something that's a must, or is it something you can do without?
Well, I, of course, encourage breastfeeding. We see a lot of benefits toward breastfeeding. Bonds the mother and the baby.
Okay.
And breast milk contains essential nutrients. Also, breast milk is easier to digest, strengthens the immune system, and the colostrum contains antibodies. Now, colostrum is the first milk that comes in.
And how long does that last?
No, about 2 or 3 days first.
Okay.
And then the rich milk comes in, but it contains the antibodies to protect from germs. Of course, it's more convenient than bottles, breastfeeding. You don't have to get up in the middle of the night and sterilize, you know.
How often are you feeding the baby?
Around every 2 to 3 hours.
Okay.
Okay. And helps protect against allergies. Again, helps uterine involution, so you go back to your pre-pregnant weight sooner.
If you're breastfeeding?
Yes. And messy diapers are not as unpleasant. In other words, breastfed babies maybe wouldn't have unpleasant
foul odor?
Yeah, as
Because that's their mother's milk, not some foreign thing that they're trying to deal with.
correct.
Okay, so every 2 hours, I mean, maybe you remember breastfeeding your children different things. Did you find that a great burden, or did you just enjoy getting up every 2 hours?
Well, this is just when the baby is, you know, after when it's first born. Of course, you need to nurse it often to establish your milk supply. And then after it's well established, you could help maintain a schedule, maybe every 3 to 4 hours.
Okay, so wait a minute. How long does it take to establish that it's well supplied, like you were saying?
Well, when you first have the baby, we encourage nursing often to bring the milk in. And like I said, it's usually around the 3rd day that the milk comes in. They're just getting colostrum at first. And then once the milk comes in, they'll have what they call engorgement, which is like, oh my, they have so much milk. But we encourage them to just keep nursing through, and you can help with engorgement maybe by doing hot and cold compresses. Some people say warm heat feels better, and some people say ice feels better, so they just experiment which one would feel better to them. And just with nursing, they can get through that, and usually after the first week or two.
What about breast pumps?
Breast pumps, some people use if, let's say they have mastitis, which is a breast infection, and they get high fever, chills, just like they have the flu. They feel awful, and it's usually from breast infection and a weakened immune system. Or we would encourage them to nurse often on that side, and if they're having problem keeping the baby awake to nurse as much as it needs to, then we would have them use the breast pump to empty that breast.
So you empty it, so that the what is it? The solution to pollution is dilution, or whatever. You just move things through there.
Yes.
And that milk's okay for the baby?
Yes, so it's fine. And we also, I find what helps for mastitis is doing charcoal compresses.
Charcoal compresses. So you just would take some charcoal, and what would you do? Is this in your book too? How to do that?
Yes, I believe it is.
And then how do you do that?
Just make a paste, put it in a cloth, and just do a poultice.
Do a poultice, and you leave it on for how long?
About 30 minutes.
30 minutes at a time?
Yes.
And then how many treatments would you do?
Just probably 2 or 3 a day.
And then that draws all of the infection out, or works on that. Any common problems people have with breastfeeding besides mastitis?
Well, just for the first-time mom, it might be a little bit rough getting started just because it's new to her. And we just encourage her to, stick with it, even though it might feel a little bit painful at first. The pain goes away. Also, we have some mothers that may complain of cracked or sore nipples, maybe just even bleeding. And what we recommend is, again, maybe doing some heat and take a vitamin E capsule and pop it over, put some oil on the nipple area right before.
The vitamin B.
The vitamin E.
Excuse me.
Right before the baby nurses, and it's soothing and healing also. Now,
if a mother doesn't breastfeed, how long does it take for her to quit producing milk? Like for instance, if it, you know what I'm saying? You understand the question?
Yes.
Okay.
Okay. I'm not real sure how long it takes for it to dry up. People vary, but you can do things, I guess, naturally to help. Like they say, like cabbage leaf.
Okay.
Will help dry up milk.
So you wear that like kind of as a poultice, or on that area. Anything that you can take to increase milk production?
Supply? Yes. You could take a combination of herbs to help increase milk supply.
Okay.
Equal parts of dill seed and anise seed and fennel seed. Equal parts.
Is that? Do you have that written down in your book as well?
Yes, I believe I do.
Those different kind of things. Those could be some real helpful things. Well, what role, if any, does the husband play in all this?
Well, of course, he plays a big role. We encourage him to just be a part of this pregnancy in every way, to help encourage the wife in labor delivery. He will be there and massaging and comfort measures and active part, and also postpartum, encouraging her and helping her with changing the diapers and
all that kind of stuff.
Bathing the baby, and of course she's going to need help with house cleaning and feeding. All
those different things. Let's go back to breastfeeding just for a minute. How often do you switch breasts, or how much on one side or the other?
Usually they nurse about 15 to 20 minutes on each side.
Okay, so the baby will feed 15 to 20 minutes, and then you switch to the other side.
Right.
And what about water? Does the baby need water or anything else to drink besides milk?
Well, if they're breastfeeding, mother's milk has all the water the baby needs in breast milk. So there's really no need to give the baby water.
Okay, so they have what they need.
Yes.
And how long do you usually tell moms that they can safely breastfeed? A year? 6 months? Is that a matter of preference?
Yes, it's usually a matter of preference, how long they feel comfortable breastfeeding, and or when the baby just, they feel that the baby needs something other than breast milk.
I'm sure you get many, many calls for deliveries and different things, but do you get a lot of calls after you've ministered in this way in homes?
Yes, we get a lot of calls even after delivery, well after their postpartum period, just to keep in touch and to ask questions, just concerns of other members in their families.
Have you ever led anyone to the Lord as a result of your ministry working as a Christian midwife?
Yes, I'm thankful that the Lord has a big part in this ministry. We pray with all our clients, and we encourage them in the Lord. And we have had good success with Bible studies and just openness.
Now, does your husband, I noticed you said the word we, does your husband and then your daughter's name is Genesis, I think, and then your son's name is Jason, do they see this as much their ministry as you do?
Yes, I couldn't do this without their encouragement, because they play an active role in every time the phone rings in the middle of the night, and just encouraging me to do seminars and being away from home so much.
Yeah, your son's kind of your right-hand man.
Yes, he is.
Brings those things, and I know that your daughter as well, and speaking with her, just really sees this as a part of her ministry as well. Well, thank you so much for coming and sharing with us. We've been talking to Patty Barnes. She's a certified midwife. She has had over 750 deliveries. She has a delightful new book called The Ministry of Midwifery, a manual that goes through many things that we've covered that take us through the pre-birth process, all the way through delivery, then postpartum care, all these different aspects. It's a real blessing. We hope that what you've learned has been helpful, and we hope that as a result of today's program, you'll have life and have life abundant.